What is cancer? Normally, in our human body, the cells divide in a regulated manner. Once the cell division is over, if the function of the cell is over, then it has to die by itself. This process is called as apoptosis. For example, under any circumstances, if cell is continuously multiplying without any regulation and it is failing to undergo apoptosis, this forms a mass of tissue leading to an abnormal proliferation causing cancer. Next, what are the common symptoms of cancer? The common symptoms of cancer depends on type of cancer. It varies site to site. For example, in breast cancer, the symptoms include a lump in the breast, change in the size and shape of the nipple, discharge from the nipple, and swelling in the axilla. For example, in a case of lung cancer, the symptoms include cough, breathlessness, chest pain, and hemoptysis. What are the symptoms of cancer? In general, the symptoms of cancer include, for all cancers, typically anemia, anorexia, and asthenia. These are the common three symptoms of any cancer. And to be more specific, the symptoms depend from site of the cancer. For example, if you take about breast cancer, the symptoms include painless lump in the breast, change in the skin color over the breast lump, and change in the size and shape of the nipple and nipple discharge. Whereas coming to the lung cancer, the symptoms include cough, breathlessness, hemoptysis, and chest pain. In the similar way, various cancer symptoms depend on the site of cancer. Now, what are the risk factors for the cancer? The risk factors of the cancer depends on type of cancer. As we already said, in lung cancer, the most common risk factor is smoking. Whereas in colon cancer, one of the important factors is diet and obesity. In breast cancer, it is mainly hormone related. So the risk factors of cancer vary from cancer to cancer. How to reduce the risk of a cancer? As we know, the risk factors of majority of the cancers include obesity, smoking, alcohol, environmental pollution, and sedentary lifestyle. So in order to reduce the risk of these, we need to adapt a healthy lifestyle, maintain a healthy weight, avoid sedentary lifestyle, stop smoking, and stop alcohol. Can we detect cancer early? Yes, we can detect the cancer early. There are some tests called as screening tests. Normally, screening tests are the tests which are done in asymptomatic individuals. The type of screening test depends on the type of cancer. For example, if you take cervical cancer, there is a test called as pap smear to detect the cancer early. Similarly, for carcinoma breast, that is a breast cancer, mammogram is a screening test. For colon cancer, colonoscopy is a screening test. Yeah, we can detect the cancer early by means of screening test. How do we confirm the diagnosis of cancer? One of the most important questions the patients do have is how to confirm the diagnosis. The most important investigation to confirm any form of cancer is biopsy. By doing biopsy, does the cancer spread? This is one of the most common myth among majority of the patients. Will my cancer increase by doing biopsy? The answer is no. Biopsy does not increase the chance of spread of cancer. How do we confirm the diagnosis of cancer? The diagnosis of cancer can be confirmed by doing a test called as biopsy. By doing biopsy, will the cancer spread? The answer is no. By doing biopsy, the cancer does not spread. How do we stage cancer? Staging of cancer is done by PET scan. What are the treatment options of cancer and what are the latest advances of cancer? Treatment options of the cancer include, the treatment options of cancer depends on the stage of cancer. In the initial stage, if the cancer is present in stage 1, usually the treatment modality is surgery. If the cancer is present in stage 2 and stage 3, which we call it as locally advanced tumor, we use multimodality of treatment, like a combination of chemotherapy, surgery and radiation, depending upon the patient to patient and depending upon the type of tumor. And especially in advanced tumors, that is stage 4 cancer, Usually we are left with chemotherapy. In place of chemotherapy, the newer advanced treatments include targeted therapy, biological therapy, and immunotherapy. What are the chances of survival in a cancer? The chances of survival in a cancer depends on stage of cancer and a type of cancer. It can vary from 90% or 100% to as low as 20%. For example, if you are speaking about a lung cancer, the stage 1 lung cancer, the chances of survival is to a tune of around 95%. Whereas the stage 4 lung cancer, the chances of survival in a metastatic disease is approximately 25%. Even in stage 4 lung cancer, with the latest advancements in the treatment like targeted therapy, immunotherapy, the chances of cure or survival is increasing day by day. What are the side effects of cancer therapy? In general, the side effects of any chemotherapy is usually hair loss, decrease in blood counts, infection, and the other side effects depends on type of chemotherapy given. What is the cost of therapy? The cost of therapy depends on type of treatment, and the cost of treatment also depends on stage of therapy. For more information on the cancer,
I am available for teleconsultation on Medicast app. Kindly download the app from the link given below.